the hospital interns at Rood Riddle Equine Hospital. If you are a horse owner, it is very important that you know how to take your horse's TPR, or temperature, pulse, and respiration. These vital signs can provide valuable information to both you and your veterinarian in regards to your horse's health. For example, if your horse has a fever, it might indicate that your horse has an infectious process going on in its body. If your horse has an elevated heart rate or respiratory rate, it might indicate that your horse is in pain.
All you need to take your horse's vital signs are a watch and a thermometer. If you have a stethoscope, it is helpful for taking your horse's heart rate, but it is not necessary. You can also just palpate an artery and get a pulse. A thermometer can be purchased for only a few dollars at just about any local veterinary supply store or veterinary supply website. A horse's normal temperature should be between 99 and 101 degrees Fahrenheit. A horse's normal pulse or heart rate is about 28 to 44 beats per minute. A horse's normal respiratory rate is about 8 to 16 breaths per minute. It is best to take your horse's respiratory rate first before disturbing him and causing his respiratory rate to increase. Observe the rise and fall of his flank or belly for 15 seconds. Multiply this by 4, and that is his resting respiratory rate. Next, you should take your horse's heart rate. If you have a stethoscope, position the bell of the stethoscope just behind your horse's left elbow. In a healthy horse, you should hear a lub-dub about every other second. Occasionally, a third beat can be heard. This is usually normal and nothing to worry about. Count the number of beats you hear in 15 seconds and multiply by 4. This is your horse's heart rate. Or, you can just palpate an artery in your horse's face to get his pulse. The easiest arteries to use are the facial artery and the transverse facial artery. The facial artery runs along the curve of your horse's jaw and can be felt when light pressure is applied over it. The transverse facial artery can be felt just behind and below your horse's eye. Once you can feel a pulse in either of these arteries, count the number of pulses you feel in 15 seconds and again multiply by 4. To take your horse's temperature, stand very close to his hip on one side or the other. Use one hand to move his tail slightly to one side and the other to gently insert the thermometer several inches into the rectum. The thermometer will beep when it's done. Then you can record your horse's temperature.
If you've never taken a horse's TPR before, it may be very helpful for you to practice on a healthy, quiet horse. This will help you become familiar with what normal vital signs are. If you have any questions or concerns regarding your horse's health, it is important that you contact your veterinarian right away. And being able to provide your veterinarian with your horse's TPR will be very helpful for both of you.